How do heterophile antibodies affect thyroid TG levels? Imagine you're tracking your thyroid health after treatment for thyroid cancer. Your doctor orders a blood test to measure thyroglobulin levels, a key marker to see if any cancer might be returning. But sometimes, the results can be confusing. You might see a higher thyroglobulin level than expected, even when there are no signs of disease. One reason for this can be the presence of heterophile antibodies in your blood. Thyroglobulin is a protein made by the thyroid gland. After thyroid removal or treatment, doctors measure its levels to monitor for remaining or recurring cancer. Ideally, if the thyroid is gone, thyroglobulin should be very low or indetectable. However, the accuracy of this test can be affected by certain substances in your blood, including heterophile antibodies. Heterophile antibodies are a type of antibody that can bind to animal antibodies used in laboratory tests. These antibodies are not specific to any disease and can develop after exposure to animals or animal products. When they are present, they can interfere with the immunoassays used to measure thyroglobulin. This interference can sometimes cause falsely elevated thyroglobulin levels, which is called a false positive. The way this happens is quite interesting. The test for thyroglobulin involves antibodies that capture and detect the protein. Heterophile antibodies can bridge these test antibodies, mimicking the presence of thyroglobulin and making the test read higher than it really is. This is different from thyroglobulin autoantibodies, which usually cause falsely low results by blocking the detection process. While heterophile antibody interference is possible, studies show it is relatively rare in everyday practice. Most patients do not experience significant interference, but when it does happen, it can lead to confusion. For example, a patient might have a high thyroglobulin level years after treatment, but no other signs of cancer. Or the level might be higher when on thyroid hormone suppression than after stimulating the thyroid with medication. These clues can suggest that heterophile antibodies are causing the false reading. Doctors can check for this interference by retesting the blood sample using special techniques. They might use tests that block heterophile antibodies or switch to alternative methods like mass spectrometry, which is not affected by these antibodies. Sometimes, they perform dilution tests. If the results do not change proportionally when the sample is diluted, it can indicate interference. Understanding this is important because falsely high thyroglobulin levels can lead to unnecessary worry, additional tests, or even treatments. If your test results seem inconsistent with your clinical picture, discuss this with your healthcare provider. They can help determine if heterophile antibodies might be affecting your results and decide on the best way to get an accurate measurement. In summary, heterophile antibodies can sometimes cause falsely elevated thyroglobulin levels, which might mislead your doctor about your thyroid cancer status. While this is not common, being aware of it helps ensure proper interpretation of your blood tests. Always consult your healthcare team about any unusual or unexpected results, as they can guide you through additional testing options to clarify your true thyroid health. Remember, each person's situation is unique, and your doctor is the best resource to interpret your test results in the context of your overall health and treatment history.